DOLA Custom Prescription Education, Shell Modifications. Behind the design, digital corrections. This section of the presentation will explore shell modifications, including flanges, first met cutouts, plantar fascial grooves, heel apertures, and Mortons extensions. Behind the design, medial flange. This client needed a custom orthotic to provide maximum arch support in multiple planes. It was applied to a flexible pronated foot with symptomatic tibialis posterior pathology. The aim of this orthotic was to apply a high medial orthotic support with a combination of intrinsic and extrinsic prescription variables. They used the DOLA Custom Orthotic service. They selected a medial flange from the shell modifications section within digital corrections on the DOLA detailed prescription form. Key features of this selection include an extension of the height of the medial border of the orthotic, extending the medial longitudinal arch upwards. The flange extends from the medial heel cup with an apex at the navicular to taper at the first metatarsal shaft. The extension follows the anatomical medial flare in the cast or scan and results in an increased height of the orthotic in the medial longitudinal arch region. A medial flange also forms part of a UCBL device, combined with a lateral flange and high heel cup. Orthotip. The aim of a medial flange, in combination with the medial arch of the orthotic, is to support the MLA, the talar navicular region, the first met cuneiform region, and the first ray in the frontal, sagittal, and transverse planes. The height of the flange can be prescribed by the practitioner. Note: footwear fit should be considered when prescribing a flange as it results in increased medial bulk. The control and bulk is influenced by the orthotic shell material. An EVA shell will be high medial bulk with less control. A poly shell will provide moderate bulk with high control. A medial flange can be adjusted or removed with a grinder. Behind the design, lateral flange. This client needed a custom orthotic to provide lateral stability at the heel and midfoot. It was for a flexible supinated foot type with symptomatic tissue stress pathology. The aim of this orthotic was to provide lateral stability with a combination of intrinsic and extrinsic prescription variables. They used the DOLA Custom Orthotic service. They selected the lateral flange from the shell modification section of the digital corrections on the DOLA detailed prescription form. Key features of a lateral flange include an intrinsic extension of the lateral border of the orthotic shell, extending the lateral orthotic shell upwards. It runs from the lateral heel cup with an apex at the cuboid to taper at the fifth metatarsal shaft. It results in an increased height of the lateral border of the orthotic. It also forms part of a UCBL device, combined with a medial flange and a high heel cup. Orthotip. The lateral flange aims, in combination with the lateral arch of the orthotic, to support the lateral longitudinal arch, the subtalar joint, and mid-tarsal joint, assisting in the frontal plane, sagittal plane, and transverse plane control. The height of the flange can be prescribed by the practitioner. Note: footwear fit should be considered due to the increased bulk. Note: control and bulk is influenced by the orthotic shell material. EVA will provide high bulk but less control, whereas poly will provide moderate bulk but higher control. A lateral flange can be adjusted or removed with a grinder. A lateral flange is common to assist with lateral ankle instability and perineal issues. Behind the design, plantar fascial groove. This client needed a custom orthotic that accommodated a tight fascial band. The orthotic needed to provide significant orthotic control but ensure patient tolerance and comfort. The aim of this orthotic was to ensure tolerance and comfort in a functional orthotic style using a combination of intrinsic and extrinsic prescription variables. They used the DOLA Custom orthotic service. They selected the plantar fascial groove in the shell modification section of the digital corrections available on the DOLA detailed prescription form. Key features of this selection include it's an intrinsic or in-shell groove in the orthotic shell. It can be applied to a polypropylene, 3D printed or EVA orthotic. 2 mm is the lab standard depth. It can follow the path of the fascia or other structures. It can be marked on a cast, impression or scan. The depth and shape can be prescribed by the practitioner, and it can be used to reduce irritation from the orthotic shell. Orthotip. The practitioner can mark the path or location for the groove on the cast or foam impression directly, using clinical photos, or using a template. Behind the design. First metatarsal cutout. This client needed a custom orthotic to facilitate sagittal plane function at the first MPJ. The patient showed signs of functional hallux limitus in a mildly pronated foot. The aim of this orthotic was to facilitate sagittal plane function, improve the windlass and propulsion with a combination of intrinsic and extrinsic prescription variables. They used the DOLA Custom orthotic service. They selected the first metatarsal head cutout from the shell modifications section within digital corrections on the DOLA detailed prescription form. Key features of this selection include the removal of the orthotic shell at or behind the first metatarsal head. The distance of the cutout is to scan or cast or as scripted. The shape of the cutout can be curved or straight or as scripted. Indications include to improve first MPJ function by plantar flexing the first ray, in functional hallux limitus, to improve the windlass mechanism, to improve propulsion, to promote high gear toe-off, to accommodate a rigid plantar flex first ray, in tissue stress pathologies including HAV, first metatarsal exostosis, first metatarsal cuneiform dorsal lipping, plantar fascia pathologies, lesser metatarsal head pathologies, and hyperkeratosis. Clinical tests and observations include using the JAX test to assess windlass functions, and gait signs including low gear toe-off, avoidance of high gear, impaired windlass, impaired gait timing events. Orthotip. A first metatarsal cutout can change shell stability with the removal of the anterior orthotic edge. A first metatarsal cutout is a permanent change to the orthotic shell. If unsure, consider using one of the alternative orthotic modifications that can be easily adjusted or removed. They include a 4-foot extension with a first met cutout, a reverse Mortons extension, or a 4-foot valgus extension. Behind the design. Heel aperture. This client needed a custom orthotic with a super soft feel in the heel for a scar. They marked the scar location on the cast and provided a shoe template. The aim of this orthotic was to ensure a super soft feel in the heel for the scar location. They used the DOLA Custom orthotic service. They used the heel aperture selection within shell modifications in the digital correction section of the DOLA detailed prescription form. Key features of this selection include the modification of the orthotic shell with the removal of the posterior central heel section. The aperture is filled with poron and protected with a top cover and a Durafit underlayer. Orthotip. A heel aperture is a full thickness cutout of the orthotic shell in the mid-heel section of the orthotic. It can be used to reduce the rear foot thickness of the orthotic, therefore producing a lower profile device, to place poron in an area needing cushioning. Note: think about the placement of the aperture with respect to the anatomy and pathology. A heel aperture will remove part of a heel skive prescription. The aperture will also be deep if applied to a design with a heel raise or high rear-foot post angle, so use with caution and thought. A pour-on heel pad is often more effective in plantar heel pain symptoms than a heel aperture. A pour-on pad can cover a larger area and not interfere with other prescription variables. Behind the design, Mortons Extension long. This client needed a custom orthotic to accommodate surgical fixation of the first MPJ and Hallux IPJ. They needed to restrict movement and use footwear modifications for a compensatory gait pattern. The aim of this orthotic was to restrict first MPJ and IPJ movement. They used the DOLA Custom orthotic service. They selected the Mortons Poly Extension Long from the Shell Modifications section in the Digital Corrections section of the DOLA Detailed Prescription Form. Key features of the Poly Mortons extension include an extension of the polypropylene shell material under the first metatarsal head, crossing the MPJ and IPJ to end distal to the hallux apex. The extension to match the width of the hallux following the anatomical flare. The thickness of the polypropylene Mortons extension will match the shell or as scripted. Ortho tip. Treatment-directed testing of this orthotic prescription variable is recommended. The aim of this modification is to restrict or brace MPJ function and should be used only where clinically indicated. It is used when normal function is not possible due to surgery, injury, advanced disease process, joint degeneration, or classification as hallux rigidus. This treatment option is often combined with other management options, including footwear modification. Behind the design, Poly Mortons Extension Short. This client needed a custom orthotic to accommodate hallux rigidus of the first MPJ. The aim of the orthotic was to restrict movement, while footwear modification was used for a compensatory gait pattern. The aim of this orthotic was to restrict first MPJ movement. They used the DOLA Custom orthotic service. They selected Morton's Poly Short from the Shell Modifications section within the digital corrections available on the DOLA Detailed Prescription Form. Key features of the Poly Mortons Extension Short include an extension of the polypropylene shell material under the first MPJ, crossing the first MPJ and ending proximal to the IPJ. The extension will match the width of the hallux following the anatomical flare. The polypropylene thickness of the Morton's extension will match the shell or as scripted. Ortho tip. Treatment-directed testing of this orthotic variable is recommended prior to use. The aim of this modification is to restrict or brace the first MPJ function and should be only used where clinically indicated. It is used when normal function is not possible due to surgery, injury, advanced disease process, joint degeneration, or classification as hallux rigidus. This treatment strategy is often combined with other management options, including footwear modification. Behind the design, Toewalker Extension. This client needed a custom orthotic to address a habitual toe walking pattern in combination with other management options. They completed successful treatment-directed testing with a flat polypropylene extension. The aim of this orthotic was to promote a change in gait pattern. They used the DOLA Custom orthotic service. They selected Toewalker from the shell modification options on the DOLA iPad prescription form. Key features of this selection include An extension of the front edge of the orthotic shell forward at the normal angle and shape of the orthotic shell past the MPJs 1 to 5. The length of the extension is prescribed by the practitioner based on the change required and the treatment-directed testing results. You can indicate the length of extension required using the instructions section, by marking on the cast or scan, or marking on a template. Care must be taken in the appropriate prescription of this orthotic shell shape. The length of the orthotic shell can be adjusted to the traditional proximal to the metatarsal head length with a grinder based on tolerance or clinical outcomes. Treatment-directed testing of this orthotic prescription variable is recommended before use. Behind the design, Cuboid Notch. This client needed a custom orthotic to support the cuboid area. They completed successful treatment-directed testing of a cuboid pad. The patient was symptomatic for cuboid syndrome. The aim of this orthotic was to replicate the successful treatment-directed testing. They used the DOLA Custom orthotic service. They selected the Cuboid Notch from the shell modification section on the DOLA iPad prescription form. Key features of this selection include a raise in the height of the orthotic shell under the cuboid, size to match the cast or scan provided, height prescribed by the practitioner, can be manufactured as either an intrinsic in-shell or extrinsic addition. Uses include to support the cuboid, to support the lateral column, provide a lateral orthotic reaction force. Orthotip. Cuboid notch prescription options. A cuboid notch can be an intrinsic shell shape applied in the CAD orthotic shell design. It can be prescribed within a polypropylene, 3D printed, or EVA orthotic shell. Another option is as an extrinsic addition, applied to the dorsal surface of the orthotic shell under the cuboid. It can be made from either Poron or EVA, making it easily adjusted or removed. It is also a common orthotic modification post-dispense. For more information on DOLA Orthotics, follow us on Facebook, Instagram, and YouTube. Access our DOLA Custom manual at dolaorthotics.com.